On June 24, 2009, Michael Jackson resided in a rented mansion in Holmby Hill, Los Angeles, California. With only 19 days remaining until his highly anticipated return to the stage for a sold-out series of 50 concerts at London's O2 Arena, marking the most significant comeback of his career, a tragic turn of events unfolded. 40 years prior, Michael Jackson had made his explosive debut as the lead singer of the Jackson 5, transitioning from a gifted child vocalist to a global phenomenon who ascended to an almost unparalleled echelon of artistry. Beyond his vocal prowess, he was the king of pop, an icon of performance art, capable of transforming a stage into an earthquake, a dance move into history, and his name into an indelible part of popular culture. For decades, Michael Jackson was widely recognized as one of the most successful entertainers the world had ever witnessed, with estimated earnings of approximately $750 million from music, royalties, albums, and concerts. However, beneath the glare of the spotlight and public adoration, Michael Jackson's career was also marred by profound personal adversities. In 1984, during the filming of a Pepsi commercial, a pyrotechnic malfunction caused his hair to literally catch fire on stage. That night, Michael not only sustained second- and third-degree burns to his scalp and various other body parts, but he also entered a world that would haunt him for the rest of his life: the reliance on analgesics and cosmetic surgeries. Years later, tragedy struck again. In 1999, during the Michael Jackson and Friends concert in Munich, Germany, he suffered a fall from a height of approximately 15 meters after an aerial lift malfunctioned. Following the performance, Michael collapsed and was rushed to the hospital, where he was once again treated with potent pain medications. Initially, these were merely medical solutions to help him overcome his injuries. Over time, however, they gradually became an invisible crutch that Michael found increasingly difficult to abandon.
Compounded by physical pain, immense psychological pressure, a grueling touring schedule, and prolonged isolation, the King of Pop's health began a subtle yet profound decline. Perhaps the most terrifying issue was not on stage or in front of cameras, but in the shadows, whenever he attempted to close his eyes to sleep. Michael suffered from severe chronic insomnia. There were periods when he could not sleep for 3, 4, or even 5 consecutive days. His body was exhausted, yet his mind remained relentlessly active. Gradually, the only means by which he could achieve sleep was no longer natural rest, but rather pain relievers, tranquilizers, and ultimately, propofol. By the late 1990s, Michael had developed a severe dependence on propofol. Propofol is not a conventional sleep aid. It is a potent anesthetic typically administered by anesthesiologists to induce unconsciousness in patients during surgical procedures. Yet, for Michael Jackson, it became the sole method to attain what most people consider the simplest necessity: sleep. He became so accustomed to propofol that he referred to it as his milk, owing to its milky white appearance. This seemingly innocuous nickname, however, masked a chilling indicator of how far Michael Jackson had descended in his desperate struggle against pain, insomnia, and his own body. By early 2009, Michael was not only physically depleted, but also engulfed in another crisis: financial ruin. Nearly his entire vast fortune had largely evaporated. Protracted lawsuits, mounting debts, and uncontrolled spending habits had dragged Michael Jackson from the pinnacle of fame to the brink of bankruptcy. For 12 years, he had lived in relative reclusion, refraining from touring and releasing the global blockbuster albums that characterized his heyday. While his legendary status persisted, it was overshadowed by a stark reality. Michael Jackson was burdened by approximately $400 million in debt and facing over 30 pending lawsuits. For him, there was only one viable path to solvency: a return to the stage.
Consequently, Michael signed a colossal contract with the entertainment conglomerate AEG to embark on a concert series in London titled This Is It. The tour was anticipated to mark the triumphant return of the world's greatest entertainer. However, the Michael Jackson of 2009 was no longer the prodigious performer of his prime. He was older, physically weaker. Old injuries, chronic insomnia, dependence on medication, and years of sustained pressure had profoundly eroded him internally. His last tour had been many years prior, and now he faced preparation for a massive concert series with the expectation that he could still dance, sing, and command the stage as he had during his golden era. Despite the immense challenges, Michael remained resolute, viewing this tour not merely as a performance contract, but as the ultimate gamble of his life. His legacy, his financial future, and perhaps, in his mind, the opportunity for the world to see him as a legend once more, all hinged on it. The initial plan was for the first performance to take place in July 2009, with rehearsals commencing in late April at the Staples Center in Los Angeles. Suddenly, Michael was required to dance, sing, synchronize with music, and collaborate with dancers, stage directors, lighting and sound technicians, and production crews for many hours, 5 to 6 days a week. For any healthy artist, such a regimen would be arduous. For Michael Jackson at this point, it was a silent torment. To remain alert and functional during the day, Michael desperately needed to sleep at night. However, natural sleep had become an unattainable luxury. He needed to suppress back pain, stress, and overwhelming exhaustion. He required more than a quiet bed. He required pharmaceutical intervention. Michael's plan was to navigate this demanding period with the assistance of familiar old friends, propofol and benzodiazepines. Yet, propofol is not a drug that can be administered casually like a few sleeping pills. It is a potent anesthetic, typically administered solely within controlled medical environments equipped with monitoring devices and specialized personnel. Therefore, Michael required a unique companion, a private physician willing to assist him with this sensitive and dangerous matter. As part of his agreement with AEG, Michael requested the hiring of a personal doctor to oversee his care throughout the tour. AEG agreed, and the chosen individual was Conrad Murray. At the time, Murray, 56, resided in Las Vegas and was mired in severe financial distress. He had a complex personal life marked by multiple extramarital relationships and 7 children with 6 different women. Mounting child support obligations quickly escalated into legal actions, leaving Murray encumbered by over $700,000 in outstanding child support judgments. Furthermore, he was delinquent on his mortgage payments for his Las Vegas villa and carried substantial credit card debt. In short, Conrad Murray was desperate for financial relief. Then, in 2009, he received a phone call that promised to resolve nearly all of his financial woes. The call was from Michael Jackson, the king of pop. During their direct conversation, Michael conveyed his needs to Murray, stating, "I require assistance with sleep. I particularly favor the medication administered to me during past surgical procedures." As one might infer, that medication was propofol. As a board-certified physician, Conrad Murray's professional obligations were unequivocally clear. He should have counseled his patient, explained the inherent risks, and most importantly, he should have unequivocally refused. He should have stated, "No, propofol cannot be used as a sleep aid. No, it is medically inappropriate, and no, it is far too dangerous." This, however, was not Murray's chosen course of action. Instead, he proceeded to supply Michael with the requested medication. In return, Murray received a monthly retainer of $150,000, equivalent to approximately 3.8 billion Vietnamese dong in 2026, a lifeline during his financial crisis. From a debt-ridden doctor, Murray abruptly became the personal physician to the world's greatest entertainer. He flew from Las Vegas to Los Angeles, remaining by Michael's side, overseeing his tour preparations and, crucially, assisting him during the nights Michael could not sleep. Following each rehearsal at the Staples Center, Michael would return to his Los Angeles home at 100 North Carrollwood Drive. There, Murray would administer propofol and other medications to Michael. They even converted a bedroom within the residence into a de facto administration suite for the drugs. It must be re-emphasized that propofol is not a sleep aid in the conventional sense. It does not induce natural sleep. It renders the body unconscious through chemical means, preventing patients from awakening during surgery. In essence, it is not sleep, it is chemically induced unconsciousness. Consequently, propofol is solely permissible within controlled medical environments. When a person is receiving this medication, they must be continuously monitored, as propofol can depress respiratory rate and lead to respiratory failure. In the worst-case scenario, it can cause the patient to stop breathing. Yet every night, Murray would induce a state of anesthesia in Michael within his own home, a comfortable private bedroom, but completely devoid of essential medical monitoring equipment. Murray failed to connect Michael to cardiac monitoring systems to warn of abnormal heart or breathing rates. He also did not have adequate life-saving equipment readily available in case of complications. These are absolute requirements when administering a dangerous drug like propofol. Approximately 2 months passed in this manner, a seemingly inescapable loop, with Murray maintaining that his methods were appropriate. However, circumstances began to spiral out of control. By that point, Murray had administered propofol to Michael Jackson for approximately 60 consecutive nights. The cumulative dosage administered over this period was substantial, indicating a profound and sustained reliance. Following warnings and pressure from the tour organizers regarding Michael's deteriorating health, Murray began to express concern. If Michael continued his dependence on propofol, he might not be sufficiently alert, stable, or healthy enough to commence the London concert series. Therefore, Murray decided to withdraw propofol from Michael. Yet what he implemented was not a properly structured withdrawal protocol. For the 2 most recent nights, Murray did not use propofol as usual. Instead, he attempted to induce sleep in Michael using benzodiazepines, a class of sedatives known for their anxiolytic, muscle relaxant, and hypnotic effects. While seemingly a safer alternative, this was still a high-risk approach. Murray did not address the root cause of Michael's insomnia, nor did he enroll Michael in a legitimate treatment program. Murray merely substituted one central nervous system depressant for another. As these medications began to accumulate in Michael's system, the Carroll Wood bedroom ceased to be a place of rest. Michael Jackson was now perilously close to catastrophe. At 1:30 a.m. on June 25, 2009, Conrad Murray administered a Valium tablet to Michael Jackson, hoping it would induce sleep. Valium, a benzodiazepine, is commonly used to reduce anxiety and produce sedation. However, prolonged use can lead to dependence. 30 minutes later, Michael remained awake. Murray then switched to lorazepam, a faster-acting benzodiazepine. But an hour later, Michael still could not sleep. Murray proceeded to try a third drug, midazolam. Throughout the early morning hours, Murray continuously administered sedatives to Michael. However, Michael's body seemed to have surpassed normal thresholds of response. He remained awake, exhausted, and trapped in an agonizing state, his body weary, yet his mind refused to shut down. Around 10 a.m., Michael desperately requested the only thing he believed would still be effective. "My milk, my milk." He wanted propofol.
Initially, Murray resisted the request, but Michael protested, stating he could not function without sleep. If he couldn't sleep, the London concert series would face cancellation, a prospect he deemed catastrophic. At 10:20 a.m., after hours of failed attempts, Conrad Murray made his final and ultimately fatal decision. He administered an intravenous dose of propofol to Michael Jackson. Finally, the King of Pop slipped into a deep state of unconsciousness. Immediately thereafter, Murray committed the gravest dereliction of medical duty imaginable. He departed, leaving Michael unattended and unmonitored, without continuous observation, adequate warning systems, or proper medical supervision. It was during this period that Michael Jackson ceased breathing. Murray did not realize this immediately. He was preoccupied with personal matters, including checking emails on his computer. Only after some time, upon returning to check on his patient, did Murray discover that Michael was no longer breathing normally. Murray panicked. He attempted to resuscitate Michael. Strangely and frighteningly, despite being a physician, he failed to administer cardiopulmonary resuscitation, CPR, correctly. Rather than treating the situation as an urgent medical emergency, Murray acted clumsily, slowly, and erred critically during the most vital moments. At that point, the most obvious course of action was to immediately call 911, yet Murray failed to do so. Instead, he called Michael's private security team. Shortly thereafter, a bodyguard rushed into the room. Instead of immediately requesting emergency services, Murray instructed the bodyguard to assist in concealing vials of medication and intravenous propofol bags. In other words, while Michael Jackson lay unresponsive, Murray was still preoccupied with attempting to clear incriminating evidence from the room. Only then did he utter, "All right, call 911."
Ultimately, more than 25 minutes after his initial discovery that Michael was not breathing, Murray instructed for emergency services to be called. Some sources even suggest the delay could have extended to as long as 83 minutes. Regardless of the exact duration, the fundamental nature of the event remained unchanged. Michael Jackson lay in a critical state, while the physician paid to protect him delayed, panicked, and attempted to control the aftermath before calling for life-saving assistance. Michael was subsequently rushed to the hospital, but by then it was too late. He was pronounced dead. the world's most celebrated entertainer, passed away not on a stage, amidst flashing lights and roaring crowds, but in his private bedroom after a night of desperate struggle, under the care of a physician who, by all professional standards, should have known precisely what he was doing. 2 months after Michael Jackson's passing, the autopsy findings, the post-mortem examination results, were released, with the Los Angeles County Medical Examiner concluding that Michael Jackson's death was not natural, but rather a homicide. The investigation focused on his personal physician, Dr. Conrad Murray, who was subsequently tried for involuntary manslaughter. The drug propofol became central to the proceedings. Murray testified to administering merely 25 milligrams of propofol to Michael Jackson around 10:40 a.m. However, toxicology reports contradicted this, indicating a significantly higher concentration of propofol in Jackson's bloodstream at the time of his death. This disparity raised the pivotal question regarding the origin of the additional medication.
Murray disclaimed responsibility, asserting that Jackson had independently administered a supplementary dose of propofol after Murray had left the room. The defense maintained that this self-administered dosage precipitated the pop king's immediate demise, making intervention by Murray impossible. The prosecution presented an entirely different account, contending that Jackson's death was not an accidental, self-induced event, but a direct consequence of Murray's medical practice. Prosecutors alleged Murray had established an intravenous propofol infusion system in Jackson's bedroom. He was accused of severing the cap from a propofol vial, inserting it into a saline bag, and allowing the anesthetic to continuously flow into Jackson's system as he slept. A theoretical inconsistency arose. If propofol had been pre-mixed in a saline bag, traces should have been detectable in the intravenous tubing above the injection port. Forensic analysis, however, found no such traces, presenting a challenge to the prosecution's argument. They hypothesized the existence of a second intravenous line, which Murray purportedly concealed, yet this alleged tubing was never recovered. Nevertheless, this evidentiary gap proved insufficient to sway the jury's ultimate conclusion. The fundamental issue was clear. Conrad Murray had administered a potent anesthetic in a private residential setting without appropriate monitoring equipment, adequate resuscitation systems, or sufficient safeguards for his patient. Propofol is not a conventional sedative. It is a powerful anesthetic. The critical margin between a dose that induces unconsciousness and one that causes respiratory arrest is exceptionally narrow. On Michael Jackson's final night, this critical boundary was tragically exceeded. Conrad Murray was convicted of involuntary manslaughter and received a 4-year prison sentence. For the world, the trial merely reaffirmed a somber truth. The King of Pop did not perish on stage or amidst the bright lights, but in a bedroom repurposed into an improvised anesthetic environment.